Hey, this is Marty McCary here in San Francisco at the Startup Health Festival. I'm learning about new companies, meeting entrepreneurs, and we've got a bunch of them right now. Right now we've got Kelli Thomas-Drake. Come on up here, Kelli. So tell me about your company. Now your company is about sharing electronic health records and information, something we haven't really gotten right in healthcare. Tell me what your company is called MyPurpleFolder. Tell me what sort of got you into this and what it does.
It should be easier to be a patient and or a caregiver, as well as a physician. What we do is we create a universal digital healthcare master key for patients to easily and seamlessly navigate their own healthcare. So the reason it's called My Purple Folder is because I kept all my grandmother's information in a purple folder when I was taking care of her when she had cancer. And this is in homage to that. The majority of my family are all physicians, and they've been turned into input specialists, data input specialists, rather than specializing in what they do. Patients and caregivers, their family members, have been turned into, like Atlas, file cabinets with a bureaucracy of information. And what we're doing is we're simplifying the process for all of them, all in one stop.
So you got into this because your grandmother was sick or dealing with some conditions.
Yes.
And in order to keep track of everything, you decided to literally get a purple folder and keep all her records in there. And then you thought, hey, there's a startup company that could address this.
And what's interesting is that I didn't think of it in terms of business. I thought of it in terms of looking for something that would help me in my time of need at that intervention. And instead, it turned out where everybody needs this, especially with chronic illness, disease, especially with just dealing with different things. I don't have any chronic illness, but yet I have about 17 different electronic medical record systems that I have to interact with, just because various physicians everywhere have their ways of wanting to decipher information. We leverage and connect existing patient data, and we don't have to store the information either. We make it visible. We use a little bit of blockchain. We use a little bit of AI. We use a little bit of... You also should not have to be a medical laureate, Nobel laureate, in order to understand what's going on with you.
I see you've got the purple flower there, and that's in line with the company MyPurpleFolder.
Yes.
So tell me, is this compatible with all electronic health systems out there? And how's it different from what's out there now, like Apple has their own little product, and how is this different?
So the way that it's different and the unique identifier is that we don't just list out medications, we don't just list out diagnoses and treatment plan, we make it visible so that you can interact with it. And so in an already traumatic instance that you're going through with yourself or your family member, you don't have to feel intimidated and or stupid in that instance. You can just tap and click and see what's going on with yourself, with a family member. You can share through an encrypted expiring link. We connect to the back-end electronic medical record systems as a proxy, and we don't have to store the information.
I see.
Because we are not another redundant electronic medical record system. We leverage and connect so that you don't have to. You should only have to just deal with being a patient.
So let's say you're a non-Silicon Valley person.
Yes.
You don't really know what encryption and blockchain means.
Okay.
Explain in everyday terms, this is an app that does what and how do you use it?
So MyPurpleFolder is an electronic healthcare mobile app system that helps you simplify your healthcare life.
Do you actively put stuff in there, or does it directly connect to electronic health records?
So what a patient does is they connect to MyPurpleFolder, they establish an account, we create the universal digital healthcare master key, and we do the heavy lifting digitally because it's a bidirectional data system. So that abstraction layer is such that wherever you have care providers, wherever in your healthcare universe, we will connect to that And every time you look at it on your phone or your personal device, you see everything in a centralized way. It's visible, it's easily clickable, and you can engage with your illness.
I like easy. I like that part of it.
Oh, it's the easy patient care button. And so therefore, you can just do that through establishing an account. We do the heavy lifting. You don't have to do anything but just let us know where you have disparate healthcare system records.
It's designed to help.
That's it.
Designed to help.
Designed to simplify.
I like it. Kelli, thanks for explaining that. Great to meet
so
you.
much. Nice to
Thanks
meet
for
you as
coming
well.
on.